Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Welcome to another episode of I Am You. I am here today with JoAnne. JoAnne, thank you for accepting to be here today.
Oh, thank you.
I am excited for you to be here. So, JoAnne, I want the women that are listening to our podcast today to know that I cannot emphasize enough, shortness of breath is a very common symptom when it comes to women and heart disease. And that shortness of breath in a woman can represent many things. And I think that your story is going to be very valuable for them. And if we could title this podcast, anything will be like, what can shortness of breath mean in a woman? And you are that particular patient that we encounter on a daily basis, that it has very poor quality of life, that continue to go on a system that doesn't understand what is going on, and that continue labeling our women with conditions that they might not have, or making them believe that it is all in their heads. So why don't you start sharing this story, and then we go from there.
Well, my story started with I couldn't breathe. I just couldn't breathe, and I was going for a colonoscopy, and they got the rhythm of my heart, and they said, we're not going to give you this colonoscopy. You got to take care of your, the unrhythm of the heart, the whatever.
Do you know that you had a rhythm problem at that point?
No, I didn't.
So you were getting ready for the colonoscopy, and they're like, your heart is not beating normal. It's irregular.
It's too irregular. We don't want to be responsible. You have to go to a cardiologist right away.
Okay.
All right. They made an appointment for me at a cardiologist there in the Villages. I go there, and he had me walk around, and he said, well, I'll tell you what. My suggestion to you is you go home and sleep with a CPAP. For your, go home and sleep with a sleep pack I told him the shortness of breath. Okay. So after about 4 weeks of this, I called back and I said, hey, it's getting worse. I hired a dog walker to walk the dog. I can't walk across the street. Come on in. I come on in. He has me walk up and down the hallways. He says, I don't know. He says, I still think you better sleep with the sleep pack. You're just, it'll be fine. And the nurse suggested a water pill. Oh, my God, that helped, because I felt like I was drowning, too. So that helped, but I couldn't get rid of the dog walker. I sat and watched all the YouTubes. I went all around the world. I saw all the cooking shows, and I said, this is not me. I cannot live like this. Somebody gave me Dr. Alvarez's phone number and said, here's the woman who's going to save your life. I said, yeah, she'll be the third cardiologist in the Villages. Sure enough, I go there. I am in tears. And they promised me in your office that you were going to make me well. You're going to heal me. And I didn't leave your office till I got everybody, all your receptionists. I don't know if you know this, but I made your receptionist, your bookkeepers.
I didn't know that.
All your nurses, anybody I saw in your office, I made them promise me that I wasn't going to live with the shortness of breath. I was going to get my doctor, you can do this. And they're all laughing. They all know me. They all started laughing. We promise this. I said, because I can't be the only one like this. You come in. I had an ablation. We had the ablation. That did not take care of this. Can't breathe. It's terrible. You can't breathe at night, and oh my God. I come into the office.
Before you go into the office chapter.
Yes.
Let's for the audience, we're gonna go back a little bit. So they diagnosed you with atrial fibrillation.
Yes.
Yes. So at this point, do you already have the diagnosis of sleep apnea?
No.
Okay. So when this provider that is seeing you is saying, go home and wear a CPAP.
Right.
He's assuming that
I
you
had
have
one.
sleep apnea or that you have a CPAP, but never was discussed with you.
No.
These are the potential causes for atrial fibrillation, and sleep apnea is one of those. So it was just assumed that you had sleep apnea. And then the second thing is that atrial fibrillation. Did you understood what atrial fibrillation was?
No.
Okay, so you only knew that you couldn't breathe. For you as a patient, it's more like I cannot breathe.
Right.
Did you ever felt your heart racing?
No.
Okay. So
No.
So for the audience, shortness of breath, as I mentioned at the beginning, it can be so many things. Now, when we see a woman that is short of breath and we see atrial fibrillation under EKG, it's an irregular heartbeat. And because the heartbeat's so erratic and so fast, there is a percentage of patients that are going to present with shortness of breath. And then in women, more commonly, because it can be combined with other conditions that we're going to be discussing in just a minute, as you're going to elaborate. But many times it's assumed that the atrial fibrillation is what's making them short of breath. So in your case, you went through an ablation. An ablation is the procedure to get rid of that atrial fibrillation, or at least minimize the episodes of AFib and try to stabilize the rhythm. Once we do that, if the shortness of breath is related to the atrial fibrillation, more often than not, it's like a switch. Now I feel much better. My shortness of breath went away. My quality of life has been restored. But in your case, you took care of that atrial fibrillation, but now you're like, I'm still short of breath. This is not helping my shortness of breath. But by then, were you already in my office, or you had the opportunity to see any of those providers after your ablation when you were still short of breath?
No. I
No.
came in
Okay.
after that ablation.
You were expecting to feel better after the ablation?
Yes. Yes.
You said that I was the third cardiologist that you saw. And
Yes.
and perhaps that explained why you were like, please promise me that she's going to make me feel better. Because this is not my first, nor my second, it's my third time. And although we cannot promise that we're going to do it, we promise that we're going to try. Yes,
You did. Your offers promised me I wasn't leaving.
And then we said, we'll promise that we're going to try to understand what is making you feel like that. Because like you, we get a lot of women that come because they have not been able to feel better and they still don't have an answer to their symptoms. So you come into the office and you're like, please, please, please. And what happened?
Okay. You smiled and you said, we can take care of you. And you did. You gave me 2 medications, took me off a couple of medications, just switched those around. I think it was the 3rd or the 4th day I called your office, and I was crying. I got my life back. I got my life back. I sat in my chair and watched YouTube from all of December until April when I came to you. That's a long time from somebody that's active. Not good, not good. Yes, the dog walker lost his job. He's no longer around.
I'm sorry for him,
I
but
know.
I am so happy that you back to walk that dog.
I am just back to normal. It feels good to feel good and to know. I mean, I thought I was at a dead-end street. I'm not that old. I thought this is my life here. I'm in this chair. And it's nice to know there is help out there. You got to find the right person. There are people out there that know what they're doing. But when that doctor told me to take a walk down that corridor and wanted to see how out of breath I become when I walk down the corridor, I thought to myself, this is a joke. This has got to be a joke.
Did you feel that at that moment, since we are touching on that event, that they didn't believe that you were as short of breath as you were saying you were?
Yes. When he had me do that, and then he had me do the other, yes, I started to think he thought it was in my head.
Like he wanted to prove that you are as short of breath as you were, no?
Right.
So one thing that I want to mention here is that when we find, first of all, in order to be able to help our patients, we need to understand what is going on with them, no? So what you had is a very common condition in women. You have diastolic heart failure. It tends to be underdiagnosed in women. A lot of women had what appears to be a normal echocardiogram, but they keep saying, they continue to say, I'm short of breath. And what is not realized is that their heart are not relaxing properly. And that is the reason why they are so short of breath. And heart failure is the most common form. The diastolic heart failure, the heart doesn't relax well, is the most common cause of heart failure in women. But more important for you is that it is, if you don't know that that is a common problem in women, if you don't know how a woman is going to present, so it doesn't matter. You were in front of two other cardiologists that couldn't see it. They couldn't understand why is this woman so short of breath, because they did not know. So the point that we're trying to make here is that if the provider doesn't know, they won't be able to diagnose you. They're going to make you do cartwheels, and they're still not going to be able to make you feel better. But the idea of having this type of podcast or educational material is for the woman to know, well, number one, not everybody knows. So you got to make sure that you know that shortness of breath can be a heart problem, that you know that heart disease presents different in women, so that when you're in front of that provider that might not know, you can continue advocating and say, no, I know that there is something is not right. I know that my heart can be playing a role in here. Or do what you did, which is, I need to find somebody that understands what's happening with me and it can treat me. So it is about understanding. Like when I said, if I tell you, go to the grocery store and buy me an apple, but you have never seen an apple in your life, you are not going to be able to bring me an apple. You might bring me a banana, you might bring me a pear, maybe you know it's a fruit, but you don't know how it looks like. So like you, many women are going to the doctor saying, I'm short of breath, I don't feel right. And more so is the limitations on your quality of life. You just say it, no, like you were there, but you were not you. Like you're not a woman that is to be sitting watching YouTube channel all day. You were so short of breath that you can barely walk your dog. And for you, it was more about my quality of life. You knew that you could not continue to live like that, and you felt that if something was not done, your life was going to be cut short.
Right, absolutely.
So for the women that are listening to us today, that might have encountered that doctor that make them walk down the aisle to prove that they're getting short of breath, but they're still not finding an answer. To the woman that is still not able to even make their bed, go and walk their dog, what would you say?
Oh, run! You got to find the right person that knows what it's doing. I mean, like I said, no, you got to find somebody. Otherwise, I thought I was gonna end up in that chair and die. Is what I really thought. You know what it feels like to can't breathe as somebody's suffocating you like this. So no, you gotta go out and search, and like 2 pills. I come to you. You go ting 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 ting, and I'm done. I walk out of there. You gotta be kidding me.
It only took me like 28 years of my life to know like a little bit of this, a little bit of that. Yes. Oh, now, but you are right. You're right. It's like knowing what to do. And I know that I joke about it because then, because you recovered your quality of life, then you share with me that there are other members in your family that you want them to have a good quality of life too. And then I told you I might be running out of my pixie dust. And you're like, no, you cannot run out of your pixie dust. No,
my husband it just so happened the same thing's happening to him. He's been through the VA. He's been through another cardiologist. He's in really bad shape now. And I came and says, Doctor, listen, you got to take this guy.
A little bit of this, a little bit of that.
That's what you said. You got to bring out, I said, whatever potions you got or pixie dust, it'll just take you, go bing, 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 and he'll be fine. And that's...
The point that you are making, I want to emphasize for the audience is that although it sounds like it's magic, is knowing what to do. Yeah, so you had to be in front of a provider that know what to do. And knowing that for women, we've been treated for decades like little men, that they keep implementing therapy on us that doesn't work, that they don't see us, that they don't see us for who we are. They don't see us for how our conditions are different. So it's time that we start working on becoming visible. And then if you are invisible to that doctor, move to another place where you become visible and they can see you for what you are.
You know, and another thing here, you got to watch. A lot of these doctors are retirement age. And when you're in there, this is terrible to say, but they're looking at the watch. They're just sitting there to retire. And I got the feeling out of one of them especially, he kept looking at the watch. He's ready to retire. He probably won't be around much.
Like you felt that there was a rushing? What do you mean with retire? Like meaning like...
He was going to retire. He was old enough to probably retire.
And how does that translate on your care? Like they didn't want to spend the time to listen to you, or that they...
I don't think he really cared. I mean, tell me to use a CPAC. Like you said, never even asked me if I had a CPAC. I never even said anything. I just walked out of there. I mean, I thought... You
felt that you were not his priority.
No.
That he has
Wouldn't you
other priorities.
Ask somebody if you have sleep apnea? Just don't assume. So I got out of there. Then I go to another one. He tells me to walk up and down those aisles. You got to be kidding me. And he keeps looking at his watch.
Got it.
I'm out of there.
So for you, it's more about, because I know you mentioned retirement, but we're all going to get to retirement. But the point is that you didn't feel that you were they were connecting with you.
Oh, absolutely not.
You
They
felt
didn't want
rushed. You didn't feel heard. You felt that they were in their own agenda.
They didn't want to. They didn't want to.
Okay. So message for our audience. Number one, don't stop until you get an answer for your symptoms. Yes?
Absolutely.
Number two, there are providers out there that know how to take care of women. We just need to look for them. Number three, move if you're not getting that answer.
Right. And you know what? Thank God for my friends, because they could see that I was just, I couldn't do my Marjan. I couldn't go here and there. And they would come visit me. And they said, we got the doctor. This one saved my husband. She saved me. She's doctor out. Then, I went into the 24-hour walk-in clinic, because I couldn't breathe on 466A there. And I said, I'm supposed to see Dr. Alvarez pretty soon. I said, I got an appointment. They said, she's the best. She's the best. But they still made me go to the hospital.
The point here is that when you find out a provider that connect and that understand what is going on with women and women heart particularly, it's important that we share with others.
Oh, yeah,
and at the
absolutely.
same time, the knowledge. So what we're sharing today is for the women that are listening to share with others, not just keep this information for you, but other women deserve to hear that we are different. How can we find a provider that will understand us, and things that can be done for us as women, that we don't have to settle for an okay quality of life because we are old, or because we are obese, or because of whatever excuse they want to give us that is not acceptable. Because like you recovered your quality of life. Many women out there can recover the quality of life if they get the proper provider.
And too, doctor, I'm kind of new into this medical. I'm hitting the age where things are starting to fall apart. So I don't know this medical system too well. So I go in, I'm pretty green. I'm not, whatever. I just want to get well. And I go to these, now I'm not getting well, so now I got to get involved. But you got to, like you said, you got to look and search. And there are doctors out there, and I'm thrilled to death to find a woman's doctor for a woman. And that's what these ladies all came to. My girlfriends kept saying, Joe, we got somebody. Joe, we got somebody for you.
And I'm glad that you listened.
Oh, my God, yes. And you're young. I can't believe it. You're not in the retirement age.
Give me a plus.
That's right. I got you for a while.
Well, I am so thrilled that you decided to come and share your story.
I have to say one more thing. As I was leaving your office, I thought, might as well throw this out at her. She's a female woman's doctor, too. I said, hey. I said, by the way, I got aches and pains all over. I don't know what's going on, but my hips and you said, what? Stop the statins. Stop your statins. I said, okay, thanks, Doc. Bye. I stopped the statins. Those statins are nasty.
Another moment of
They're
listen.
nasty.
First, feel comfortable telling your doctor how you feel, and then listen. The doctor had to listen, because if I'm walking out of your room and you tell me something like that, and I'm like, you're getting old.
Right.
I listen. I'm like, oh, okay. So this is in your medication list. Let's try this. Don't touch the microphone. I'm so happy.
almost flipped when you told. I wasn't even going to throw that out at you. I was a
I
little
am
embarrassed
so
because we were
happy.
walking out the door, and I thought, what do I got to lose? Let me throw this at her. I can't believe it. It's great. You threw that out so fast too. So thank you, doctor.
You're welcome.
I'm ready.
Thank you.
I'm ready to do a polka.
I love it. I owe you for coming in here. I really thank you for
and
being
I owe
here.
you back for my life.
You're welcome.
Thank you.
You're welcome. You're welcome. And this takes us to an end of another episode of I Am You. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD-Dr. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.